Number, oh wait, fingernails. Hi everyone, my name is Elle and I am back at DA Plastic Surgery. I am here to get a doctor's checkup. After your surgery, it is crucial that you go and get a doctor's checkup. So that's why I am here, but I also wanted to talk to you guys a little bit about the precautions that you should take before your surgery. So let's get started. Number 1. Ooh! Pills. You should avoid taking vitamin E, painkillers, antidepressants, and antithrombotics. Antithrombotic? Antithrombotic. These days, a lot of people take supplements, which is extremely normal. Things such as birth control, vitamin E, painkillers, antidepressants, anything like that. It's best to avoid them 2 weeks before surgery. So I'll give a big no to everything you've been taking recently, probably. Just stop up to 2 weeks and you should be okay. However, if there are medicines that are pivotal to your survival, say for example, you have diabetes or hypertension, right? Things as that you can take with a small sip of water in the morning as long as you speak with it with a consultant or a medical specialist. You could do that too. Number 2. The most important thing while you're in surgery is to have clean nails, especially gel nail polish, because the oxygen saturation that's being measured while you're in surgery, it can be a little hard to measure it accurately if you have gel nails. So it's really important. I know that I have really nice, pretty nails, not right now, when I went into surgery and I did have to remove them, which was it was so sad, but I'm happy that I did it because we got some accurate readings. I was safe the whole time during my surgery. For your nails, it's important that both your fingernails and your toenails are clean without any gel nail polish during the surgery. So anything like this is a big no, especially because mine are grown out. Number 3. The next thing that you need to look out for before surgery is any accessories. I don't know about you guys, but I wear a ton of accessories, so I had to be sure that multiple times that I had removed everything. Also, any piercings that you have, if they have metal in them, they should be removed. I know you can get plastic, like space holders, to put in your piercings. That might be a good idea. And also any hair pieces that have metal in them, they need to be taken out as well. As for contact lenses, you should remove them before surgery because they can lead to corneal damage. Number 4, another thing to look out for, which was really difficult for me, was fasting before your surgery. You have to fast 8 hours before your surgery, which means no food, no water, no candy. That was me getting rid of it. You should also stop eating because it could lead to complications in the surgery room, such as vomiting, which for me is just embarrassing, but also I'm sure for the doctors it's messy and uncomfortable and could be very difficult to clean while you're in the middle of surgery, so it's best to just avoid it. It's best to do it 8 hours before. Any more would be better, of course, but at least 8 hours is required before general anesthesia. Let's see. Okay, let's talk about number 5, which was, I think the most difficult for me, which was no drinking or smoking. Absolutely not, at least 2 weeks before and after surgery. I feel like, especially being here in Seoul, it's really difficult not to drink. but it is really dangerous potentially and could lead to infection or inflammation. Even more than drinking, it's more important that you don't smoke 2 weeks before or after. Maybe even more depending on if you have a silicone implant. A lot of the risks that you have could be greater if you smoke or drink. The number 6 thing to look out for on the day of surgery is wearing comfortable clothes and makeup. Comfortable clothes is definitely something loose, a zip up, something you can easily change in and out of. So anything that looks like what I'm wearing, for example, or something with a high collar like this that would be difficult, like facial bandages, things like that, it would be best to have something loose. So clothes that are super tight and form-fitting like this, we don't want them. No. Instead, you should wear something loose and comfortable. Something baggy or bigger would probably be okay, or something that can be zipped up. And loose and comfortable pants are always nice. Another thing to keep in mind is that you shouldn't wear any makeup. That includes eyelash extensions, which you'll have to make an appointment to get those taken out. Another clothing item that should be avoided are high heels. A lot of the time, if your surgery isn't too intense, you can go home immediately. But even if you do have to stay overnight, you might be a little bit dizzy, and it would be better to wear comfortable shoes instead of shoes that would be more difficult to walk in. Thank you so much for spending time with me. For my closing thoughts, I just want to say that it's really important prior to surgery that you have a good night's sleep and that you try your best to de-stress. I know that during surgery or preparation for surgery can kind of get a little bit stressful or nerve-wracking, so just make sure you take it easy. It will be okay, and yeah, you'll look fantastic.